Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, and pigmentation. I want to walk you through this case. It's a patient who is of Asian descent. You can see his scar result over here. Thanks for, by the way, bearing with me. I had a couple technical difficulties issues earlier, but I was trying to stream on multiple platforms and it was a little bit stuck right there. So I think it should work. Hopefully if there's any questions or problems with it, let me know. You guys should be able to hear me. I'll try to take my time tonight to answer everybody's questions because I got on a little bit late because of that technical issue. So for those just joining, this is a patient who is of Asian descent. I'm going to walk you through just how I worked on this patient's scars. The last few days I was not able to stream on every platform, so hopefully we'll be able to get to everybody's questions here and answer all the questions that I also received over the last couple of days, which I hadn't gotten over. A lot of people were sending it to by DM and by comments, particularly when it comes to, I saw a lot of questions with volume, with what I would use for filler. And just generally about like collagen stimulation, things like that. So I'll talk a little bit about that as well. Vincent Wong is saying, hello, doc. What is the clinic treatment you recommend for active inflammatory acne? Well, whenever there's active acne, we really want to make sure that the cystic lesions, that the bacteria component of it is under control. So usually you want to be on something that's going to help with the bacteria. That usually involves something like some sort of antibiotic, either topical or oral. Sometimes we could do broadband light, and that could actually kill some of that surface bacteria. And, the other things that we could potentially use is actually lasers or energy devices. So we could do all those things to potentially help. Is there an audio lagging issue at all? Some people are saying that. Hopefully not. I tried to fix that up though, but I may have to reset it one more time if there is. Let me know if there is that problem again. It seems like there may be for some people, but let me know. And I'll hopefully be able to. I may have to reset the whole thing again. There was some sort of issue that was happening constantly. And not on your end. Okay, awesome. So I'll continue. If there is, let me know because I'll try to reset that then. So are results permanent? So yeah, this is your skin. Like you get to keep your skin, but there may be some volume loss that can occur in the future, and that could still show some of those scars looking deep again. So sometimes there's fat pockets that are underneath there that are supporting that scar tissue, and we don't necessarily touch those areas with filler or volume, but in the future one day you may end up needing that. So that may be something that you may notice that you still have a little bit of volume loss later on in the future, and that shows the scars a little bit more. What skin tone isn't good for this treatment? Well, all skin tones could be treated. Actually, every single skin tone could be treated. It just may be that I use different modalities depending on your skin type. So this is a patient who's of Asian descent, but for patients who are Fitzpatrick 5 and 6, so think maybe potentially South Indians or African patients, Aboriginal patients. We may end up having to do more manual work and potentially do lighter energy devices, if any energy device at all. And that's actually something to pay attention to, because we do have this balancing act where we may not want to overheat the skin and cut down to the base of the scar if it's going to cause catastrophic pigmentation issues. Even if those pigmentation issues are temporary, I try to avoid it as much as I possibly can by avoiding as much heat as possible. Sometimes you may have to do it if the scars are thicker around the edges. Like this patient, for example, his scars were thick around the edges there. We had to do the CO2 laser for that. Does diet affect results? Yes, it could. It definitely could. I do think that there's a few different factors actually that we should pay attention to. One is just genetics in general. I talk about that a lot of times, that different ethnicities really can have a more robust collagen response, a faster collagen response than in other ethnicities, and we have to pay attention to that. We have to notice that. If you have sun exposure, that could actually also be a factor. UV damage, that's going to potentially slow down your collagen response. Oily skin, that could also be a process where it causes inflammation, and then it also ends up essentially causing more inflammation and more acne. So that could be a problem where you don't end up getting enough collagen response. Even sometimes the kind of water that we're using on our face, the water we're splashing on, that could end up being a problem. Right now with the fires going on in LA, they're saying that it's possible that our water quality is even worse now, which is, shocking to think that our water quality could get even worse. But that's something to pay attention to, because when we're doing these scar treatments afterwards, you may get lingering redness afterwards if you're using some more of like the tap water. So really try to make sure you're using more like bottled water if you could, or just filtered water. And you really consider doing a filter, getting a filter for your house as well. All those things can factor into that. And then for diet, things that can potentially cause more oil production, like milk, dairy products, those could usually be a trigger. Certain sugar, refined sugar, all those things, processed food, all that could actually factor into it. So diet could definitely do it. It's just there's a lot of different variables involved, and the more we can control those variables, the better your results are going to be. This particular patient, he's a med student, and he's somebody who was really otherwise healthy, and just ended up having some severe acne at one point. But he follows exactly what I say and takes care of his skin really, really well. So you can see amazing improvement there for him. Can I get rid of acne scars completely? Well, if it's relatively superficial, you probably can. It just depends on the depth of the scar. But it's questionable whether it's going to get away completely for the vast majority of scars. Even this patient, some of his scars are probably gone completely, but there's still a lot. There's still some more scarring there. When he came in this day, we ended up doing some TCA cross, some Bellafill, and that ended up helping him out some more. Gabriel saying, hi, doctor, when can I see the results after having TCA? I'm assuming you're saying TCA cross. That's going to take a long time. Most patients, vast majority of people will say that there's a difference between like the 6-month mark and even year mark. They start noticing it's getting softer about 6 months out, but then really 1 year later, even a year and a half later is when they start noticing that it's a lot better. So it's a very, very slow process. Lepkuri is saying, does microneedling help with this type of scarring? Well, I think it's going to be pretty minimal for this kind of scarring, to be honest with you. It's not something that I would really push. This patient ended up, it's actually a sad story for him, is that he did go to a dermatologist who did TCA cross on him, but apparently it sort of splashed on his face, or it spread out really, and he had originally just more of ice pick scars, and now you can see those boxcar scars that were there before I started working on him. So, there's treatments that people will try to push and will say, and they think that they could do, but there's a way to do it really, really safely. Microneedling is definitely something that he tried, didn't really help, and then he went to doing TCA cross, and then he tried to do it, and he went to a dermatologist to get it done, and it ended up causing worse scars. So there's a way to do this. And it doesn't involve microneedling. It doesn't involve like splashing TCA all over the face. It's really about being very precise, and that's what we could do. Crying Tiger is saying, for those who suffer with past keloids on the face, can they get help with scars besides subcision? And keloids, really tricky. We always want to pay attention to that. But in general, for patients, when they say that they have keloids, really we want to make sure that afterwards, after we do any procedure, there's less friction on the area. Really, I have not run into any problem with that after doing subcision. But yes, of course, there's other alternatives. If you don't want to do subcision, maybe you just need to do a little bit of volume. That could be the option that could help out actually for that. Just a tiny little bit of volume, or of course, just lasers or energy devices. Maybe those are things that we would do. It's not that we just have to do subcision, and sometimes if it's just more superficial, we don't have to. I mean, a lot of times I don't recommend doing subcision. Odette is saying, I had filler 1 year ago and it was minimizing the pores, and then the filler was gone and pores appeared larger and skin is full of dehydration lines. I'm not sure if it was exactly quite true that it was pores. It was maybe those were tiny little ice pick scars or small scars, and that's what you felt improved with a little bit of filler. If that's the case, really we should treat it more like a scar with maybe TCA cross or excision, things like that. Those are things that you could potentially do that would end up helping that. Vincent Wong is saying, do you recommend microneedling or laser treatment for redness or rosacea and sensitive skin? A good question. I don't recommend microneedling for redness or rosacea. It could actually exacerbate rosacea. Rosacea, a lot of times you don't do lasers or energy devices, but if you do end up doing it because you want to help with the broken capillaries, help a little bit more with the inflammation, then something like XLV works very, very well. You could also do VBeam if you are the right skin type. And by right skin type, I mean that really fits 1 through 4. It could be with VBeam, at least as it currently is. But fits 5 and 6, I think it's riskier there for that. And just overall, how much pigmentation issues you have and things like that. Those are all things that we would factor into it. Let's see here. Where was I at? I missed a few questions here. Let's see if I could try to catch up on it. Is beef tallow good to heal and clear skin? I had a lot of patients try it. A lot of people said that it made their acne break out more eventually. So I can't really say. There was one person who said that it was okay for them, but I've had several other patients say that it broke them out more. So I definitely can't say that I could recommend it. I'm actually, I do try a lot of different products on my skin just to try it out to see how it is, but I'm a little bit too scared to try it because I just don't want to get right now my skin's been really clear and really smooth and I've been really happy with it. So I actually don't really want to try beef tallow just because of that. But if you try it and say if it works for you, sure, let me know. But a lot of patients have said it hasn't really helped out. Osman is saying he tried beef tallow and his acne cleared up. Awesome. I'm glad that worked out for you. I don't know if the last time I checked down over here, a lot of people said they tried it and it made it worse though. So, we could do a little poll at some point when I get a chance. What's the best chemical peel for acne? I have scars just like the picture. It may not be chemical peel that you would do. It may be that you would do subcision with TCA cross. And then what we ended up doing was a little bit of Bellafill for this patient, as well as a little bit and some laser. Tallow. Oh, beef tallow is how it's pronounced. Someone's correcting the pronunciation for beef tallow. I'm fine with it. The only thing is that sometimes there's just too many, there was just too many Amazon affiliate links that I was seeing with those guys that are pushing it. I don't know. It was I was kind of a little bit wary of the whole thing because of that, but maybe there's some benefit to it. I'm not sure. T-Chan is saying, hi doc, thank you for reviewing my photos. What do you think of the redness of that hypertrophic bump? When will that go away? So I smooth down this patient's mole, and there's a bit of a bump there still after about a little bit of about a week. So usually just use a little bit of silicone tape. That's going to help out with that, and just hydrate silicone tape. That's pretty much all you really need to do. What do you think about pimple patches? Good idea. I don't think that's a bad idea at all. Pimple patches are good. Silicone tape is good. Less friction, the better. It's going to actually help with preventing that inflammation. So you'll notice also that a lot of times when you do that, you don't scar as much too, which is helpful too. Dermatologists say you can't achieve skin results as it originally was. Is that true? Well, it's tough to say. I mean, I think that some scars maybe that it softens up so much that it's not really visible to you much at all. But yes, if you look at it histologically, there may still be a little bit of scarring there. There's still a little bit of indentation. But day to day really is what we care about, just looking at it over and over in multiple different angles with regular light. And that it really could be less visible and less noticeable to most patients. So that's what we're trying to shoot for. I always say though that you're still going to see it under certain harsh lighting. That's just not your normal day-to-day lighting though. If you're looking at it under a flashlight, if you're looking at it, where you're in a changing room or in a really harsh elevator light, sometimes you can still see those scars, and that's normal. That could end up happening there. User 10 saying, is it normal that my Bellafill dissolves so quickly? I barely see improvement now 4 months later. So that's actually a really good point. Basically with Bellafill, it's made out of 80% cow collagen, 20% is something called PMMA. That cow collagen, the bovine collagen, goes down over the course of 3 to 4 months. And now, about 6 months to a year later, it's going to actually be a process where your body starts making collagen at that point. So it's a slower process than you think. But yes, it could go down a bit. You should still have about 20% of that PMMA that's still in there. I bet you if you look at it under ultrasound, you'll see it there. It hasn't triggered that collagen response yet, which is normal because that cow collagen went down. Now your body has to make its own collagen. Any progress on VerPorphin? Well, we do have the FDA waiver now to do it for body, which kind of threw us off a little bit because I was trying to do it for face. I have to arrange now to see the best ways to do it for the body, go back and forth with them still a bit for making sure that it gets approved for the body. They also want to make sure that we're using independent vials per patient, which costs a lot of money. Each vial of VerPorphin is very, very expensive. So there's a lot of different factors that I'm going to actually probably circle back with the people that were looking into VerPorphin to talk a little bit about how we could game plan this a little bit better for everybody. Once I get some time, we're going to do that a little bit there. But it is on my radar to work on, but really it's right now only approved for the waiver for us to do scars on the body. So if we excise a scar, we could use VerPorphin on the body, but it's going to take some time before we could approve it for acne scars, and then furthermore to do it for the face, especially. It may be a bit of time for that, but hopefully we can get it soon. I think the sooner thing is going to be more with surgical scars. I'm going to be trying shooting for that. I think that's going to be really helpful because at least if we could show something with surgical scars, we could get that as scarless as possible. That's going to be awesome. Your mom is saying, what's your take on microneedling with PRP? Can I just do one session or do I have to go back and get more? It's not going to be helpful really, particularly much for really these scars. It's really not going to help too much for most of these. It can help a little bit with the healing process, but not going to help so much for scars. Tichana is saying that will a hypertrophic scar become resolved with silicone tape? Yes, a lot of times it will, especially when it's just more like inflamed right now. It usually just doing some silicone tape, just try it for a couple weeks. That should end up helping. If not, then we may have to do a little bit of a steroid injection as well to help with it, but usually that helps enough with it. Odette is saying, does replacing fillers again with rejuvenating the skin again, or should I go with skin boosters? I guess I'm missing the question there, but I think you're asking if you just keep on doing fillers, will that help rejuvenate the skin, or should you just try doing skin boosters? You could do both. I mean, I wouldn't do just one or the other, try to potentially do both. So hopefully that'll help with you. Rena is saying, I just found you. I live in LA and would love to come for a consultation. Awesome, Rena. Hopefully you're doing okay with the fires. Hopefully. But go through my website, drqazi.com. Our prices are on there. You can just schedule a consultation directly on there. Is taking isotretinoin okay? Yeah, it's absolutely okay. It will be helpful you a lot with your acne, and then of course with the oil production, and then also with scars even. And it stimulates some collagen production as well. So it's really important for patients when they have a really cystic acne, but I also do it just as a low dose, microdosing for oil production, oil control. Do that, or something like the Acurelates could also be an option. Elise is saying, what's the best thing to do for this kind of scars? For these kind of scars, really what we needed to do was TCA cross. We did subcision. We did some laser to resurface the area. We also did a little bit of Bellafill as well for him. And he's now come in about 2 times now. And we ended up doing a little bit more TCA cross that he came in again, as well as a little bit more Bellafill for him. What is the pricing range looking for acne scars such as that in the picture? Most patients spend about $5,000 to $7,000. If they need a little bit more volume, a little bit more Bellafill, for example, it could cost a little bit more. What is TCA cross? Good question. So basically, it's a high concentration of an acid that we're going to place at the base of the scars. And the reason why is because we want to actually essentially break down the scar tissue itself and stimulate a collagen response. And then we will have to repeat that several times. Just keep on doing this, slowly soften it up, help it rise over time. Someone's asking if they could use just a derma roller. So if you're going to use, as they said, that their scars are very, very small, but they just want to use a derma roller. So if you're going to do something at home, potentially try doing the stamper instead of a roller. I would prefer that. I think there's going to be less trauma to healthy tissue that way. Stamping is probably going to be better than that rolling process. What do you do about hair on the nose showing black pores? You actually could do laser hair removal for that. And yeah, that's actually a nice way to prevent it in the future. A quick fix right now, or something that you could try to do right now, is just to add something that's going to have a little bit of an acid, some sort of chemical exfoliant. You could start with just doing glycolic acid. Do that every couple days or so, and you should start seeing that that's going to help strip away some of that debris that's getting stuck on there. Can you show more severe cases before and after? Yeah, I did that last week. I'll try to show. Some people are asking for less severe cases this week, so I'll be showing some of that this week, but I'll try to showcase a little bit more of that eventually. Lavid is saying, tried ablative CO2, 80% better now. What treatment is better for boxcar and rolling scars? So boxcar, yeah, the CO2 laser is excellent for that. Rolling scars, likely you need to do something to break up that scar tissue, so subcision, and then you may need to do something like a little bit of volume if there's some volume loss there. So all those could be options there. And Vincent Wong is saying, is IPL good for acne-prone skin, and do LED blue light therapy work? Is IPL good for acne-prone skin? Yeah, it is good for that. It's nice because if you use certain wavelengths like 415 or 420 nanometers, it could actually just kill some of that surface bacteria. If you're doing it, at a professional office, you could also do it where you could reduce some of the redness as well of acne. So yeah, it's definitely a good option for the right patient actually, and also it doesn't overheat the skin much too, which is nice too. Alex Morgan's asking, do you have any comments on the Cyton Contour TRL laser? Also, would it be better to start off with an erbium laser rather than a CO2 ablative laser for treating darker skin types? It depends on how dark of a skin type you are, how thick the scars are. But Cyton Contour TRL, I love it. It's great for anti-aging. I don't love it as much for scars though, to be honest with you. I don't find that there's much of a benefit to using it, and you still end up stripping so much of the skin that you might as well have just used a CO2 laser in my mind. So for those who don't know, that's basically fully ablative erbium laser. It's basically where it's like full field, everything gets destroyed. Like basically we could take layers and layers of the skin out with the Contour TRL. It works, nicely, but I do find that there's still just as much of a risk with pigmentation issues as you would with a CO2 laser. And, I would just prefer just to use more like a CO2, like the surgical handpiece of the CO2 laser, and just smooth down the edges of the scar and then blend it in with more of like a fractionated laser. I think that's a lot safer, especially since you're saying you're more of a darker skin type. Do you use intraocular eye shields if you laser around the eyes? Yes, absolutely. In general, do you combine more than one laser in a visit? Yes, usually I use the erbium and CO2 laser together. Usually I do that. How to prevent acne? Well, most of acne is really, if you consider it really from the start, it's really something where it's an oil production issue, a sebum issue. And so you want to control oil production. And the ways to control it could be topical creams, things like retinoids could help with it. You could also do oral medications, something if you're a female, like oral spironolactone could help. And potentially if it's more like severe, a lot of oil production or moderate to severe acne, you could do something like isotretinoin or Accutane, or you could use the laser like the Acure laser. That's very similar to isotretinoin. It works the same way in normalizing oil glands. Lex Nick is saying, why is Bellafill hard to find? A lot of places do not offer it. It's, because a lot of places just only wanted to do hyaluronic acid filler because that's kind of what their medical director was comfortable with kind of outsourcing to, their nurses or the PAs. And potentially they themselves aren't too comfortable with injecting that, or they don't do as much of that. So that's probably like the easy answer to say. I've met a doctor before. He told me, I don't think that using Bellafill is good business sense. That's what he told me. He said, you want patients to keep on coming back, and it's just a long-lasting filler. So I don't know why that would be a great idea. He's telling me that, he has patients that come back a couple times a year, and he's seeing them for, a decade or so, and they keep on coming back for some filler. And he thinks that that's better than doing something that's long lasting. So there is that philosophy out there that exists, that there's some people out there that think from a business sense, it's not great to do long lasting filler because then you don't see the patient over and over again. And it's like, I think that's kind of wild, because for me, like, I actually like doing things like, even though I'm a physician, I like doing things that just like do it and just done and just kind of like move on from it as much as I can. Like, I don't plan on just like going back and forth over and over and over again. Like, there's some things that, it's probably okay with doing it that way, but like, it's like, I'm really, really busy, like really, really tough. So it's like really hard for me to like go do things. I ever get annoyed when I go to the dental office and like, they tell me that like you have to stage like the cleaning or something like that because it's like the way that they have to build their insurance or something random like that. That's like not my fault that their insurance has to be billed that way or whatever else. I don't even know. The dental insurance is just the biggest scam in this country, honestly. And so it's like, you go there and you do something and they tell you that like you need like a deep cleaning and like that's going to be scheduled another day. And it's like, dude, it's like so hard for me to come to this like dental appointment now. So I want to just like get done with things. I want to go through and like do it properly and just move on. And, it's all like the least amount of trips as possible. Like, don't do it just because of like insurance reasons. There was a guy in the hospital, a cardiologist, and he used to like stage, like when he was doing like angiograms and putting like stents in there, he would stage it. He would do like one vessel and then like he'll like wait a few days and then he did another one. And the reason why he did that was because you could double bill for insurance. That's why he did it. He literally did it that way. He like did it like where it's like, he put the stent in there for one vessel, and we're like, there's multiple vessels here that were clogged up. I was like, well, we'll just wait. And then he just like double bills it then that way, because now it's like 2 procedures that he gets to do and two procedures he gets to charge. So that's why I don't even deal with insurance stuff. The whole thing is like a big joke and a scam, to be honest with you, especially in this country. And when it comes to like a lot of these things, there's a lot of these games that people do. Zelina saying, what are your thoughts on mesotherapy with Botox for active acne? It's great actually for that. It actually does help with that. I don't mind that at all. So I do that a lot actually for our patients. We have it. So take a look at our page. Actually, we do a lot with that. Odette is saying, do stretch pores go back to its normal size after treating them with skin boosters? Yes, it's basically an oil production issue. So you do want to make sure that you control your oil. Doc, what's your daily skincare like? Or is that a product of Perfect Genes? It's definitely not Perfect Genes, honestly. Definitely not. My family has oily skin in general, and it took a lot to be able to get to where I'm really, really comfortable and happy. I was actually thinking the other day, it was actually really interesting. I was actually thinking that like I used to be so self-conscious of like my skin, my acne, and then like my scars, and I used to like constantly look at myself in the mirror. And I'm telling patients, don't do that so much. I always say, don't look so much in the mirror. And I know some of my patients are on it right now. I see their names on there. And I say to you all the time, don't look at the mirror over and over and over again. But I did used to do that a lot. I know, and like, so I kind of want to like help you break the cycle, because it was like kind of tough, because I would just like look at myself and like double check, am I looking okay? Is that pimple like really noticeable right now? Is it like really inflamed right now? Is there a way that I could kind of like angle my face a certain way so it's not as visible or obvious to people? All those things were kind of things that I was thinking. And it's nice like to get to a point, but although now I'm like 42 years old, so it took a while. But it's nice to get to a point where it's like, okay, I don't have to worry and stress about that anymore. It's like really, really great. But it took a lot of lasers. It took a lot of different things like Bellafill, for example. Those things actually, cumulative effect was like obvious now at this point, where my skin quality is a lot better now than it was even years ago. So patients that I haven't seen for a long time, it was really obvious during Christmas time. I was seeing a lot of patients that I only see like once a year, and they were saying that, and it's really because like I did a laser 6 months ago or so, and like you could see that effect now. So that's kind of interesting. So definitely not genetics. I could say that like I've been around people with like this amazing skin genetically, and it's like I used to be like, man, I wish I could have had that. And it was kind of like, you feel down about the fact that there are people out there that had it. I didn't really just appreciate it. And I kind of wish that like I did just appreciate the fact that like, there's like excellent skin, just appreciate all that. It's like, and just be thankful for what you have, and just like kind of just enjoy the other aspects of your life. And eventually at some point you could get to it. It's going to be some work. There's going to be some things you could do. But in the meantime, just kind of enjoy like beauty as it is and everything else around you, and just like enjoy people for what they are. Let's see here, where was Alex was asking something. Alex is saying, if 80% of Bellafill is metabolized, do we refill the scar again with new Bellafill after 4 months? How is volume maintained while body is building its own collagen? Good question. And it is really important to actually pay attention to this. Essentially, that's why I do stage my Bellafill treatments. I don't put it all at one time because yes, it does get metabolized, but then your body does produce some form of collagen. Now, how much is sort of variable. We don't really necessarily know how much of it is, but if there's enough of that volume gap there, it's going to be okay to actually place a little bit more Bellafill there again, wait a little bit of time, then place a little bit more again, and just kind of slowly do that and maintain that a little bit there. And then eventually, as it gets to that fuller correction, you'll notice that even if you lose weight, it's not going to be as noticeable and visible to your face. You know, I lost some weight over like the holiday time, and it's like not particularly noticeable to me. Like it's, which is really nice that I have like some sort of structure, some support in the areas where the scars are. I'm not really stressed or worried about that as much, which is awesome. You know, it's like, well, really not at all. I just have some support there. So even if patients could say, you know, my patient yesterday, she hadn't seen me in a few months. She said, "You look really skinny," and it's like, you know, my weight, gets really obvious sometimes. If I do get a little bit, like just lose a little bit, it's pretty obvious to people, but at least on my face, it seems to hold okay. And that's nice. I like that. Like at least I have something that's going to hold okay, even if I lose some of my natural fat there. So it's useful for me for that. Do you combine a cure with other procedures the same day for acne, scarring, and oil control? It depends on what we're trying to treat and what we're trying to solve, but yes, I could do it the same day. It's a different wavelength. It's totally okay depending on what we're trying to treat. Paul just got here. He's saying, is this picture being done by CO2 fractional? We did use a CO2 fractional for this patient. He's an Asian patient, so we don't want to use too much heat. We did TC across. We did ablative CO2 with some of the edges. We did fractional CO2 for some of the other areas of the face. We did some Bellafill. We did subcision for this patient. So we did a few different things, not necessarily just that. Vincent Wong is asking, what are my thoughts on AV Clear? I heard some people say it's a miracle laser that requires no downtime and no side effects. Please advise. Thank you. I think that it's got the right wavelength. I think it's nice that it's got the contact cooling, but there was a few issues that I had with it. One was that you didn't really get a real-time feedback that it was really normalizing the oil gland. You know, really, essentially, a cure does that. Every single time you fire it, you know that you're at that exact same temperature that needs to be done to normalize the oil gland. So I like that. It's doing it based on power, and as you go a little bit stronger with the power with the AV Clear, patients may not tolerate it as well. So there's different aspects with that. There's still potentially other, problems with the way that they have done the business model for the device. I think they may be changing it now, but the way they had it before was really, really cost prohibitive for a lot of patients as well. So there was that issue too. Does subcision cause sagging? Well, if you do a certain way, I think it's a possibility. It just depends on where it's done. If it's done in the upper part of the face along the zygomatic arch, I think you're going to be okay. If you're doing the lower part of the face, you got to be very, very careful. I'm capable of doing it very, very well there, very safely there. But if you're using more like blades there, like Taylor Liberator in the lower part of the face, you could run into more problems. So it has to be really, really justified to do that there. So instead, more like blunt cannula subcision is usually what I recommend. Pat is saying, my scars look like the ones in the picture. A doctor here recommended CO2, subcision, and biostimulator like Sculptra. I think those are all good options there. It makes sense, actually. That's not a bad option there for you. Doctor, what's the best treatment for acne scars and tightening of face? It depends on the types of scars. That's what really, I'm not sure what kind of scars you have, but really everything is about the types of scars that you have. If it's boxcar scars, maybe more like lasers. You still do a little bit underneath of like undermining that scar with potentially a little bit of subcision, Bellafill. But if it's rolling scar, you do subcision there. Ice pick scars, you could do some excisions, TC across. It just depends on the kind of scar you have. Tichan is saying Tichan, appreciate you. She's saying she really resonates with this. Thank you for what you do. Appreciate you too, Tichan. So you're one of the patients. There's actually several patients that are on right now that I saw their names on. Just everybody, a lot of people some people are further along in their journey. I think they may be pretty much done with it. Sometimes they're just coming on just to pop on for a moment here. But everybody should just know, just like it's not a day by day type of thing. It really is just more like month by month, like very, very slow. It's a lot slower than people think. It's not what, this process is not what everybody expects, essentially, that it's like you just do this and it's just like it's solved. There's a healing process that's involved, and that healing process can be variable depending on your skin type, depending on other things that have like a little bit of UV damage. All those things could factor into it, but that's okay. There's a lot of aspects that we could do to help with mitigating that, and also eventually, if we need to, treating that. If we have severe hyperpigmentation and it's prolonged, I can use certain lasers to clear that up, especially like the Pico laser. That works out really well for that. So don't worry too much. But Bao Kimmy, good seeing you on. Bao Kimmy saying, can't wait for my results. I can't wait. Also, you're going to love it right now. This first week, it's going to look awesome, by the way. It's going to be swollen and it's going to look amazing. You're going to think that I'm the greatest doctor ever. And then it's going to go down a bit for the next few weeks. And then you're going to kind of see your scars again and oh, what just happened? I still see these ice pick scars. I still see everything. And then it's just confusing. And over time, over the next several months, it's softer. And then eventually, as you're putting on makeup one day, you're realize, oh, it's not as deep anymore. That's the standard progression that people need to talk about. And I know that there's some patients on here, people could say that, could talk about that as well. They could talk about what they've gone through for their process. And it's the same for so many people. So just so you know. Renal, thank you so much. I've got bad acne. Paul is saying, I got bad acne scars so bad that I need to change my face. I'm at my 6th session, but aiming for 15 sessions total. What other procedures do you suggest to recover your original skin? Well, Paul, I'm not sure if that's the best option, really, to say that you should be doing 15 sessions of something like that. I do think you should double check to see what they're doing, because that sounds really, really surprising. 15 sessions is really, really surprising. I would not recommend that. My patient the other day, she came in from Romania. She did 11 sessions of subcision, 20 to 30 sessions of CO2 laser. Crazy. It was a crazy amount of things. I mean, I'm not saying she's crazy. I'm saying that whoever was doing that was just that was really unfair that they did that to her. What about a phenol peel? Well, it's appropriate for the right patient. It really has to be the right patient for this. It has to be thicker scars. You have to be the right skin type. You have to be okay with the downtime. All that has to be okay. Your blood work is normal. All that's beforehand is really important. How do I get rid of a KP? Actually, you could try a little bit of something with uric acid, urea on there. That actually helps out pretty well. I know lactic acid could help as well, but urea, I think, is a little bit underutilized for that. Lavid is saying, I heard fibroblast pen can also help with scarring. Is that something you'd recommend? Pretty much never would I recommend a fibroblast. I think that it's really, really risky. It could cause worse scarring. And it could also end up doing something where it causes more pigmentation issues. So I would not recommend that. Do you recommend any doctor in the Florida area that's similar to me? I mean, I think there's doctors all over the country that could do some aspects of these. There's aspects of potentially of the laser that they could potentially do, and maybe excisions, something along those lines. But doing it really all together, really, and doing it systematically, and also in darker skin types, I think that takes a lot more specialty, really, and really more fine tuning. And so that's why I focus a lot on this, because it's you can't really do this just sort of as a side project. It's really something that does take a lot of your time to really do at a very, very high level over and over and over again. So I don't have anybody that I would recommend that could do that way in Florida. There's very, very few of us in the country, in the world, I would say, really, really few. So I think the reason why is because it's, there's a lot involved. There's a lot of focus that's involved. There's a lot of also just there's an emotional toll that you have to pay attention to with patients. There's a lot of just like counseling and explaining. And I think that really it's like, there's some doctors that'll say that, they're passionate about it because like a family member had a scar or something like that, or whatever else. But like, it's not really the same, to be honest with you. It's not really the same because if you, it's not that you have to necessarily suffer from scars, but you sort of have to suffer from something in a way, if that makes sense. Like you sort of have to like kind of see things from a different perspective, like whatever it is, like if it's like just pigmentation or if it's just like scars, if it's acne, if it's whatever else, that you sort of look at it from like a different perspective. And there's some people who like go down that route and they like, as like sort of a defense mechanism, they become like bullies or predatory, and they view themselves like, now that they have like a position of power, they could kind of exert their power on other people and sort of put people down, and it's kind of like enjoyable sometimes for people. Like there's actually people that enjoy like seeing others get hurt. There's people that enjoy just like having a bit of authority and a bit of power, and you'll kind of recognize that. You'll see that like out there. You'll see it like you'll run into doctors like that a lot, and so it's not just about like necessarily suffering through it. It's not just about like seeing it. It's also just kind of recognizing that there's some people out there that when they suffered, they actually just don't want other people to suffer. And kind of just like find those kind of people. I think it's going to be kind of tough, but like try your best to do that, because I think that that's like really what it comes down to. It's not like necessarily that I'm the only person in the world that's like that at all, but like it's nice, if you could find that. I never found that when I was like trying to go down this journey. I didn't find it at all with anybody I interacted with. And I met a lot of different people. I also met a lot of people at like conferences and things like that. And it's like, it's like one of those things like, they're like, it seemed like they would be great. They seemed like they'll be cool. And then you kind of meet your hero in person or something like that, quote unquote hero type of thing. And then you sort of see what kind of person they are in like in real life. And now it's like, gosh, I guess that's what you are. Like you're just like all they talk. A lot of times, all these guys talk about is just like money and like stocks and like just like how to utilize AI to like get more money or something like that. And like utilize, like I'm sitting there like in at the gym and like the steam room and stuff like that. And it's like all people are talking about is just like how they're gonna use AI for like stock trading or something random like that. And it's like, there's nothing else anybody's talking about. It's all people like are focused on sometimes. And it's like, just sometimes, it's like every once in a while it'd be nice just to have like regular conversations and like have people hopefully help improve the world and improve others. If they suffered something, they could do that. And if you didn't suffer from anything, maybe you could just like, just look at yourself and think that like you should be grateful for that. And then you like yourself as like, maybe you have the ability now to help other people because you didn't have to suffer. But it's kind of rare, unfortunately. It's like rare to have that experience. I don't know. I found it rare. I went to so many doctors, so many people. I've told you before, like I went through this one dermatologist in Northwestern. She didn't even look at my face the entire time. She didn't even look at me. And she just was like with her MA and she was just like typing up a bunch of notes and she didn't even look at my face. And I wanted like Accutane. I really needed Accutane and she didn't put me on it. And it was just like, I had a little bit of doxycycline, so I didn't have as bad cystic acne, but I had severe oily skin. And she just like refused and just didn't even look at it. Like, it was just like, I remember that feeling. She was just typing away and like just kind of doing that. And there's a lot of that, like, unfortunately. So, look at that and see like kind of where you're feeling comfortable with, because that's going to be the chances are like, that's going to be the quality of care that you're going to get with physicians like that. What are your thoughts on CureJet treatment? It's supposed to be subcision-free scar treatment. I looked at it a little bit. I'll tell you, I haven't used it. First of all, just as a caveat, I haven't used it. But I did use something sort of similar to it, which I found was really, really poor. Like it was really, it was not great at all. And I thought it was going to be really like something amazing because it would be helpful because we could be able to push certain products into the skin without needles, and it ended up just not working the way they said. I was really put off by the whole thing. But I am aware that it's that's possible that was just a bad device, and that was like a knockoff, I think, of CureJet and other devices like that. But I don't know if it was necessarily the best thing. And by the way, I didn't know it was a knockoff. I was just like, basically a physician told me that this was a great product and blah, blah, blah. And I ended up leaving it. And it turned out that that guy was actually just a sales rep for the company. I didn't know. So I just started and I was thinking, oh, this is cool. Like if we could get this product and, it's needleless and it's going to work just like the same way as doing subcision, this and that. And it turned out like it wasn't even penetrating the skin properly. So that's why I'm kind of skeptical of something like CuraJet. And I don't know anybody in the acne scar world that's using it really like at a high level. So I'll have to see if anybody is. What filler do you recommend for pitted scars, skin vive? That's okay. It depends. It depends like that. If it's pitted scars, you may not even need filler, but it's like it may be like TCA cross or excision. Those are the options that potentially you could use. Yeah, CuraJet does sound too good to be true potentially, but I haven't tried it. And I haven't really heard from anybody that does scars that they've done it or tried it either. So I can't really say if that's something that is too helpful yet. But I'm open to it. I'll try it out at some point if they're willing to give me a demonstration or something like that. I'll give it a shot to see if it works out. Divine Time is saying, I had perfect skin my whole life and ended up with huge keratin plugs under my skin. I didn't know. Yeah, a lot of patients, it's like everything was normal at one point, and then it ends up like one day they had severe scarring, and like some patients, it's like one of my patients today, he called in from New York, and it was like everything was fine. He was he actually immigrated from Central Asia. And when he came over here, he's like, I think maybe it was the water. And I'm like, I think it may be the water too, because I've been talking about the water for a while. And he was like, the water broke him out, and maybe the pollution broke him out. And it was severe cystic acne, huge lesions that just like chewed up so much of his skin and so much fat underneath there. Really unfortunate, And it's like everything's going well in his teens, and then in his 20s something like that happens, and just probably because those way too harsh of water in New York or so, which is unfortunate. Let's see here. Doc, who is treating Hollywood actors' acne scars? Very surprising. There are so few specialists like you. There's a lot of people do fillers, things like that. That helps as a quick fix for a lot of patients that are really more like in front of cameras because they want less downtime. So sometimes it's just like a quick fix that they're looking for is more like a little bit of filler, which is something a lot of people do. But certainly they're just like anybody else, and they may need fuller treatments, and we just have to sort of schedule around actors or somebody who's like a newscaster or anything like that. I just really schedule around work around their schedule to see when they have a little bit more downtime. In their case, usually I try to push some of that downtime for a little bit longer because they may still have a little bit more redness, and just to be on the safe side, we try to push it a little bit more. So I try to get a little bit more time off for them. What do you think of Aerolase NeoClear for acne and hyperpigmentation? I have a consult this week. I think it's okay, not the best though, to be honest with you. It's kind of a jack of all trades, master of none type of thing. That's why I never really use it. Would Sculptra be a good filler for the scars? Sculptra is great. I mean, it's a great collagen stimulating product. It's not exactly like a filler. It stimulates collagen production, but it's not exactly a filler. So it's gonna improve your scars over time and then give you a little bit of volume, but I wouldn't put it in the category of filler there. For severe acne scar, what is the recommended treatment? CO2 laser? Well, it could be a few different things. It could be like subcision, TCA cross, volume, CO2 laser. You may need a phenol peel. All those could be options there. How much is the treatment for moderate scarring? The treatment for moderate scarring is usually, or how much is it? It's usually about $5,000 to $7,000 for moderate scars. What filler do the celebrities use for a quick fix? So it depends on how long lasting we want it, and if we want to make sure that it's something that's just like a relatively quick fix, like it's just like within or just go down like 3 months, but still look a little bit good. I should say still look pretty good. Like Skin Vive is pretty good for that. Or the skin boosters are good for that. Otherwise, you could do like if you want like more structural support. Sometimes like if it's deeper fat pockets, you may need a little bit of a thicker filler. Something like Restylane Define actually at the base it actually can end up lifting up that scar pretty well too. Depends on which layer we're doing it in. Sometimes you just use both of those. How do you get rid of a high cortisol face? I saw that kind of trending weirdly enough. I don't know why that was trending so much. It's more of a medical condition. I'm not sure what that means, that somebody would just have a high cortisol face by itself. Like you could have like puffiness. You could have like some bloating that could occur with just salt intake. But that's different than what would be a medical term of high cortisol face. Which a lot of times you really got to double check to see what is going on with your cortisol level. And that is a medical condition that you have to treat and see what's happening with it. Are you on somebody who's on exogenous steroids, things like that? Those are all things that we have to factor into, for cortisol face. But I'm not sure why that was trending. I don't know what was going on with that, but I saw that was kind of trending. Just in general, I think what people are thinking is puffiness and just decrease salt intake, just lower your salt intake. Do not pick at skin. Thank you so much, Sheikh Al-Jabal. Thank you. Do not pick at skin. It's so much more than that, honestly. So many people don't even touch their skin and they still get scars. It's just a lot of it is really just going to be about genetics. So much of it's genetics. So just so you know, it's not really about that. What's a good resource for doing more advanced acne scar treatments, like using TCA Cross or learning these techniques? Well, I do some trainings. Some of them are open. It's super tough to get them because it's like for the full year, it's pretty much already booked up already. But you can submit it and we can see if we get to you at some point. And right now I'm doing I'm going to kind of sign off for tonight, but right now I'm training somebody who's incredible, and she'll do a lot of these type of things. And so she's going to be awesome for it. So just so you know. Sama is saying, I'm from Gaza. Please donate. Link in the profile. And we will. Hopefully everybody donates to Sama. It's sama.family1 on IG. Go click on the link to the profile. I put it up there a little while ago. Like I was going to match all these donations. Hardly anybody was doing it. I don't know what was going on. It'd be really nice. I'm not expecting everybody to post about it and talk about it all the time and things like that, although people really should be. But like, at least try to give money to the people that are suffering like this. It's like we're causing their suffering. So it's like, I don't know, just like you suffer from like certain things and things like that. Now imagine like the amount of suffering that these people are going through. And so, yeah, like people should donate to someone like this that is trying to just like literally like imagine their lives were okay. Everything was going fine. And now what's happening to them? So just give a shout out to them. Go try to donate to them and try to see if you could help them out as much as you could. I'm not expecting you to give a ton of money, but just try, something. Something to help out with people. It'll make you feel good too, like that. Like one day when like in the future, when everybody knows what happened and everyone's going to know, everyone's going to know what happened. Everyone's going to say that they were against it, afterwards. Everyone's going to say, oh, I was really against it. I was really against it. And, you will feel a lot better if you like kind of support some of these families and so, and these people that are suffering over there. So hopefully, you guys will do some of that. All right, guys, thank you so much. I will see you tomorrow night. Take care.